The room is quiet. Your partner is asleep. Your mind is wide awake. You felt the pleasure. You reached climax. But the proof you expected wasn't there. And your stomach drops. Right there. Stay with me. This is the moment many men over 50 freeze. I'm Dr. Claire Monroe, a urologist with over 15 years helping men over 50 restore erectile function naturally. And I want you to hear this clearly. This isn't a failure. It's a signal. Tonight, you will learn why dry climax can happen, what it can mean for your health, and what you can do next. You will also get a simple list in this format: causes, warning signs, solutions. Here is the key idea. Your body can still feel pleasure while the delivery system changes. Most men never got taught this. That is why panic starts. Turn to page 2, because that is where the shame trap begins. You might be thinking, I'm the only one. That thought is a liar, and it keeps you silent. Here is how it usually plays out. One dry moment happens. You say nothing. You act normal. But inside, you start scanning yourself. Every bathroom trip. Every morning. Every time intimacy could happen. This is where the fear grows. Stay with me. In my clinic, I hear this pattern from men your age all the time. Men 50 to 75. Good men. Hardworking men. Men who love their partner and do not want to disappoint her. I also see the same next step. You start avoiding closeness. Not because you do not want intimacy. Because you fear that dry moment will look like failure. And shame is sneaky. It makes you pull away to protect your partner. But it quietly hurts both of you. Here is a real example with details changed for privacy. A 59-year-old man came in looking calm on the outside. Inside, he was tight with worry. He told me he had started making excuses. I'm tired. I have work. Let's do it another night. His partner thought he was losing interest. He thought he was losing his manhood. That is the emotional crash. He was scared it meant cancer. He was scared it meant aging took it. He was scared his partner would judge him. Now listen closely. Those fears are common, but they're not the same as facts. In visits like this, I look for patterns I see every week. I have seen this in men from every background. I ask about medicines for blood pressure and prostate symptoms. I ask about surgery history, even years ago. I ask about diabetes and nerve health. I ask about urinary changes like frequent night trips. Why? Because dry climax is often a mechanical issue, or a blockage issue, or a hormone issue. Not just black and white. Context matters. I also watch what happens to your confidence. Many men say, I feel tense before intimacy. That tension changes breathing and blood flow. Then worry gets worse. That is a loop. This is the moment you take back control. You stop guessing. You start tracking. Most men wait months. Some wait years. And the whole time, they carry it alone. You do not have to. You deserve clear answers. If you feel embarrassed, that is normal. If you feel scared, that is normal. But you do not have to live in guessing. Here is the bottom line. Your body is talking. Your job is to listen, not to punish yourself. New Bat KY fan now trong so nai keen ban can they coach you vi quentwak. Hey go one veo fan ban wanda ban ling la thua nan voy chin min ring day la du ban muante doi. Here's the science in plain language. Climax is a brain event. Ejaculation is a plumbing event. That sounds simple, but it changes everything. Stay with me. Think of your body like a house with two systems. One system is the wiring. That is nerves and brain signals. It creates sensation and pleasure. The other system is the pipes. That is glands, ducts, and a gate at the bladder. It moves fluid in the right direction. You can have strong wiring and still have a pipe problem. That is why you can feel climax, yet see little or no fluid. This is not you failing. This is your body giving data. Most men assume fluid equals performance. That is the trap. Here is the key point. Your nervous system controls timing. Small muscles squeeze in a rhythm. Nerves tell the gate when to close. Nerves tell the pipes when to push. If nerve signals get weaker from age, diabetes, or some medicines, timing can slip. You still feel pleasure, but the plumbing part misfires. What this means for you, One new pill can change the pattern. One old surgery can change the pattern. That is why your history matters. Now listen closely. You are not broken. You are misreading the message. What this means for you, you stop judging your masculinity by a visual sign. Now, bring confidence into the picture. Confidence is a signal of safety, not willpower. When your brain feels safe, your nervous system stays calm. Blood flow and muscle timing work better. When you feel panic, your body reads danger. Confidence drops, breathing changes, and the system tightens. Confidence is a signal of safety, not willpower. That is why shame makes symptoms feel bigger. Here is the valve image. Picture a small gate at the exit of your bladder. During climax, that gate should close. It forces fluid to go forward. If the gate stays loose, fluid can go backward. Your pleasure can stay the same. The direction changes. Here is the blockage image. Picture a thin straw. If swelling or scarring narrows the straw, flow drops. Production can be normal. Delivery looks dry. Here is the fuel image. Testosterone is like the supply power for the glands. If fuel runs low, volume can drop first. Then energy, mood, and erections can feel different too. What this means for you, dry climax is not one single story. It is a few common stories that look similar. Now you are ready for the clear structure. Causes. Warning signs. Solutions. Turn to page 4. This is the point most men miss. Because this is where you get the calm, step-by-step plan. Your body isn't broken. Your strategy is. Stay with me. This isn't a failure. It's a signal. Not just black and white. Context matters. Now here is the structure you can trust. Causes. Warning signs. Solutions. I will tell you the safe next step each time. Causes. Cause 1. Retrograde ejaculation. The gate stays open. What it is, fluid goes the wrong direction, backward into the bladder. Why it happens. Think of a bathroom door that should lock at one moment. During climax, a small valve at the bladder should close. If the valve is too relaxed, fluid takes the easier path. What this means for you. You can feel normal pleasure and still see dry results. Your desire and sensation can stay intact. Safe next step. Look at your timeline. Did this start after a prostate or bladder procedure? Did it start after a new medicine for blood pressure or prostate symptoms? Write it down before you forget. Microhook. This is more common than you think. Cause 2. Duct obstruction. The pipe is narrowed. What it is, the glands can make fluid, but the delivery tube is blocked. Why it happens. Picture a straw with sticky syrup inside. Swelling, scarring, or tiny calcifications can narrow the path. Less gets through, so volume looks low. What this means for you, a slow drop over months can point to a flow problem, not a desire problem. Safe next step. Notice any new pelvic pressure, discomfort, or a change that became gradual. If that is true, schedule a urology visit for evaluation. Cause 3. Low testosterone. The fuel is low. What it is. Hormone levels drop enough that glands run underpowered. Why it happens. Testosterone helps the prostate and seminal vesicles do their job. Think of a car running on low gas. It still moves, but it does not perform the same. What this means for you, lower fluid can be the first sign. Later, energy, mood, sleep, and erections can also shift. Safe next step. Ask your doctor for a simple blood test. Do not guess. No. Microhook. Guessing keeps you anxious. Warning signs here is the hard truth. Most cases are manageable, but some signs mean you should not wait. Warning sign 1. Cloudy urine after intimacy. What it is. Urine looks milky or cloudy soon after climax. Why it happens. If fluid went backward into the bladder, it can mix with urine. What this means for you. This can support retrograde ejaculation. It is often not dangerous, but it is a clue. Safe next step. If it happens, note the timing. Bring that detail to a clinician. It helps a lot. Microhook. Details beat fear. Warning sign 2. Pain, burning, fever, or new severe discomfort. What it is. Pain during climax, burning with urination, fever, or chills. Why it happens. Inflammation or infection can irritate the ducts and prostate. Sometimes swelling blocks flow. What this means for you, this is not a watch and wait moment. This is a get checked moment. Safe next step, call a doctor or urgent care, especially with fever. Avoid self-treatment and delay. Warning sign 3, blood in urine or fluid, or a numbness/loss of sensation what it is, visible blood, or a new loss of feeling in the genital area. Why it happens, blood can come from irritation, infection, or other causes that need evaluation. Numbness can point to nerve problems. What this means for you, do not push through this. Do not power your way past it. Safe next step, seek an urgent urology evaluation. Fast answers protect long-term health. Microhook, speed matters sometimes. Solutions now the part you actually want. What can you do that is safe, realistic, and respectful? Solution 1, get the right assessment. Stop guessing. What it is, a focused visit that matches your symptoms to the likely cause. Why it works, a good diagnosis is like a map. Without a map, you walk in circles. What this means for you, your fear drops when you have clarity. Your confidence returns when you have a plan. Safe next step, bring a short note with medicines, surgeries, onset date, urinary changes, energy changes. Microhook, a timeline is power. Solution 2, review medicines and medical history. Fix the hidden trigger, what it is. Some medicines relax smooth muscle. Some surgeries change nerve timing. Some health issues weaken nerve and blood vessel signals. Why it works, if the trigger is known, the plan gets simple. Sometimes an adjustment is possible with your prescriber. What this means for you, your body isn't broken. A piece of the system got nudged. Safe next step, do not stop medicines on your own. Ask your doctor, could this affect ejaculation or confidence? That one question can change everything. Microhook, ask the question. Solution 3, treat inflammation or blockage, restore flow safely. What it is, if swelling or scarring is part of the story, treatment targets the obstruction. Sometimes medication calms inflammation. Sometimes a minimal procedure restores flow. Why it works, if a pipe is narrowed, opening the pipe restores delivery. What this means for you, relief can come from fixing mechanics, not forcing performance. Safe next step, if discomfort is present, get checked. Do not normalize pain. Microhook, pain is information. Solution 4, address low testosterone the right way. Measure first, what it is. Testing hormones, then discussing options with a clinician if levels are truly low. Why it works, if fuel is low, the system underperforms. But treatment must match the real cause, not a guess. What this means for you, better energy and steadier mood can support erections and intimacy confidence. Safe next step, prioritize sleep, daily walking, and strength training basics while testing happens. Those habits support hormone balance naturally. Microhook, basics beat hacks. Solution 5, break the shame loop with one simple strategy shift what it is. You replace secrecy with a calm script. You stop avoiding intimacy and start protecting connection. Why it works, confidence is a signal of safety, not willpower. When you act calm and clear, your nervous system calms. That supports blood flow and timing. What this means for you, your partner often fears rejection more than symptoms. Clarity brings closeness back. Safe next step, say one sentence, I noticed a change. I'm getting it checked. I still want closeness with you. That is enough. Microhook, one sentence can save a relationship. Now, back to the 59-year-old man. He did not need a miracle. He needed a map. He wrote down his timeline. He realized the change started after a prostate medication. He also noticed more night bathroom trips and higher stress. After evaluation, he understood the cause. He stopped blaming himself. He talked to his partner with the simple sentence. And here is what happened next. When he changed the strategy, the outcome changed. Not a perfect life. Not a guaranteed result. But real relief. Less fear. More connection. More confidence. This isn't a failure. It's a signal. And signals can be decoded. Truup kai tip tuc, hei chan mot doi quen van esibat dao toi ne. Viet so qua doi quen du veo van benwan. Mot han dong siu the hu qua han muoi wai din tot. Take a slow breath. You are not less of a man. You are a man getting a message. Here is the recap, simple and calm. First, climax and ejaculation are not the same. Pleasure can stay, even when fluid changes. Second, the most common causes fall into 3 buckets. A gate problem, retrograde. A pipe problem, duct blockage. A fuel problem, low testosterone. Third, warning signs matter. Pain, fever, blood, or numbness deserve faster medical care. Fourth, solutions are real. A timeline, a focused exam, and basic tests can bring clarity. Then the plan matches the cause. And remember this. This isn't a failure. It's a signal. A signal is not shame. A signal is information. Your dignity stays intact. Your intimacy can still be warm and connected. Your confidence can return because confidence is a signal of safety. In my office, men often walk in tense and leave lighter. Not because everything changes overnight, because the mystery ends. If this happened once, you still deserve clarity. If it keeps happening, you still deserve help. Either way, you do not have to hide. Hold on to that. Page 6 gives the next step and the follow-up topic. You do not need more pressure. You need a clean next step. Most men wait too long. You can act sooner, calmly, with dignity. Dat mua chia si voi mot nuoi danong tren 50 tuoi zem video teep theo de zem truok. Kai nao the doizit tin lavio hai. Fa kai nao la dao hu can gap bac nai. Stay with me. That next video will help you separate normal change from red flag. Not black and white. Context matters.